Good morning, and welcome to the 2024 Drug Treatment Court Conference. My name is Justice Barnes. I'm the chairperson of the Association of Justice and Treatment Professionals. Today, our first plenary session is entitled The Opiate Crisis in the Legal System, Challenges, Barriers, and Strategies to Optimize Successful Outcomes. And before I introduce our esteemed speakers for today, let's do something very important, the land acknowledgement. We will begin this webinar by acknowledging that we are meeting on the Aboriginal land that has been inhabited by indigenous peoples from the beginning. As settlers, we are grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. Long before today, as we gather, there have been Aboriginal peoples who have been stewards of this land. In particular, we acknowledge the Anishinaabe, Huron-Wendat, Haudenosaunee, the Ojibwe, and Chippewa peoples. The land that is home to the Métis, and most recently, the territories of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. This is the land from which I speak to you. We recognize and deeply appreciate their historic connection to this land. We also recognize the contributions of the Métis, Inuit, and other indigenous peoples, the contributions they have made in shaping and strengthening this community, in particular our province and country as a whole. As settlers, this recognition of the contributions and the historic importance of indigenous people must also be clearly and overtly connected to our collective commitment to make the promise and challenge of truth and reconciliation real in our communities, and in particular to bring justice for the lives lost in residential schools, as well as the murdered and missing Indigenous women and girls across our country. Today's presentation will be recorded. At the end of this session, you will receive a copy of the recording. You will notice that we have a Q&A. Your chat function has not been enabled. Please send all your questions to the Q&A, and at the end, somewhere at the end of their presentation, Stacy and Ashley will be answering your questions. We're very pleased that Stacy Ledger and Ashley Spear have generously agreed to give up their time to speak to us on this important topic. When you were registering for this session, you had an opportunity to look at Stacy's bio, and you know that she's an opiate case manager with the Pinewood Center of Lake Ridge Health. And Ashley Spear is an addictions counselor, rapid access addiction medicine clinic, Pinewood Center, Lake Ridge Health. So having said that, Stacy, over to you.
Thank you very much. I'm just going to take a moment here to share our presentation slides, and then we will go ahead and get started with our presentation today. Just give me one moment for those to load. Are you able to see the slides? Ashley, yes. Okay, perfect. Excellent. So as mentioned, myself and Ashley are here from Pinewood Center, Lake Ridge Health. We are an addiction agency here in Durham region, and we're going to just be speaking a little bit today about the opiate crisis in Durham region, some of the supports and services our organization provides, and the impact in terms of the justice system as well. Before we begin today's presentation, we would like to take a moment to acknowledge and honor those who have been deeply affected by the devastating opioid crisis. This crisis has claimed far too many lives and have left countless families and communities grappling with the profound loss and pain of the crisis and the loss of the lives affected. Let us take a moment of silence to remember those who have tragically lost their lives due to the opioid addiction, as well as their loved ones who continue to feel the impact of those losses. As we delve into the discussion today, let us keep in mind the importance of addressing this crisis with compassion, understanding, and a commitment to finding solutions that can reduce further suffering of the crisis. When we look at the opioid crisis, being that Ashley and I both work in Durham Region and specifically in Oshawa, we wanted to share some of the facts and statistics around what this crisis looks like in Durham Region. Now, we understand that some of you may be from Durham Region or different areas across the province, but what we know is that the trends that we're seeing in Durham Region are similar to the trends that are being noticed across the province. So the trends that we know are that overdose continues to rise year after year, unfortunately. There's a general increase in the number of emergency department visits for opioid poisonings in Durham Region residents over the last 10 years, with those numbers fluctuating from one month to the next. But when we look at it year to year, we see that those numbers are increasing over time, year after year. Between 2013 and 2022, the rate of emergency department visits to Durham Region residents due to opioid poisonings almost tripled. So in 2023, it was 24.8 visits for every 100,000 people we had. And in 2022, we were looking at a number of about 70 visits per every 100,000. We don't have the statistics yet for 2023 year, but we are expecting that that number did continue to rise. And then when we look at deaths due to opioid toxicity or fatal overdoses in Durham Region, that too has also increased in the last 9 years. So when we look at the stats for Durham Region, this is from 2021. There were 129 deaths related to opioid poisonings in Durham Region specific, and that was 7 times higher than the number of 2013. So from 2013 to 2021, again, the number has continued to increase in terms of the fatal overdoses that we've experienced and the loss that we've been experienced in the community. When we take these numbers into consideration, one piece to take into consideration is what impact does this have on Durham Region? And one way of looking at is when we think about the 129 individuals that were lost in 2021, if we were to put that on the front page of the newspaper and we were to look at that in terms of 2 buses of people, every year in Durham Region, we are losing 2 busloads of people to the opioid crisis and to opioid overdose deaths. And that's Durham Region. So if we then move to Kawartha Lakes, we move to GTA, we move to Haliburton and surrounding areas, and we start to look at what is the impact of this across Ontario, those numbers are massive. The opioid overdose and toxic overdoses continues to climb year after year after year since we started tracking this stat. Within Durham Region and within each regional municipality, there is a tracking system that is a part of the hospitals programming, as well as a provincial database system that tracks overdoses, near misses, and paramedic requirements with regards to people needing intervention related to opioid overdose. So that's where we've been able to gather this information and track the trends to know what's happening, where do we need to be, and how can we support people better in the community. So who are we, Ashley and I, and what do we do? So at Pinewood Center, we are a harm reduction agency. So I'm sure many of you are familiar with what is harm reduction, but harm reduction really means, oh, sorry, I hit the slide there early. Harm reduction really means that we are an agency that looks at supporting people with regards to addiction and mental health concerns across the continuum. On one side of that continuum are people who are actively using, who do not want to make any changes to their use. And on the other end is people who have been actively using and are working towards abstaining from use, meaning not using at all. And we support everybody across that continuum from one side to the other. So people who don't want to make changes but might be required to access services, people who are starting to notice some problems with regards to their substance use and wanting to get more information or education, people who are starting to notice that their substance use is having a negative impact on their use and they're wanting to start making some changes or some reductions to their use, or people who understand that their substance use is having a big impact on their life and they need to stop using it completely. So at Pinewood Center, the way in which we do that is through a harm reduction model. So when somebody accesses services here, they get to pick what goal they want to work on. We provide them with education and information about the best practices and the supports available in the community as well as within our organization. And we provide them with harm reduction strategies and tools with the understanding that we want to be able to engage a person in a meaningful way so that they keep coming back to services and have the opportunity to continue to address their substance use concerns. So in doing so, we do provide harm reduction services here at Pinewood Services, and these are just some of the opportunities that they have within our organization or in the community organizations. So we do provide harm reduction supplies here, both inhalation and intravenous drug use kits and supplies that can be requested anonymously by presenting at any of our Pinewood Center locations. We do have benzodiazepine, xylazine, and fentanyl test kits. These are test kits that are available to individuals to test their drug supply that they're getting on the street, to be able to better understand what is in their drugs. And by doing so, it helps to be able to reduce the overdoses because people are more aware of what is in their substances. And it also helps to be able to reduce alternative side effects too. We provide condoms as part of the Safe Sex program. We provide overdose prevention in terms of education and information. And we also have a monthly drop-in group that anyone from the community, anybody who's actively using, family members, community partners can attend to be able to get information around overdose prevention and the opportunities available within the community. We have an naloxone distribution program here. So naloxone is the medication that helps to reduce reduce the harm when somebody is having an overdose from opiates. So we do distribute naloxone here. And then we also share information about some of our other community supports. So there's the National Overdose Response Service, or NORS, which is missing 18 in the telephone number. It's 1-888-688. 6677. So that number there is a telephone line that offers people support by phone so that they don't have to use alone. And if they did require medical assistance, they would be able to get that through the telephone support line. And then we also access our John Howard Society community partners with regards to a mobile unit that can also share harm reduction supplies in the community by dropping them off or picking them up from people as well. And then part of our harm reduction strategy is also to be able to have clients self-direct their goals. So we allow clients to be able to tell us what it is that they want, what it is that they need, and then we look at how can we support them within the services that we have to address those. Again, coming back to the best practices and knowing what supports are available within our organization and the community. Another harm reduction strategy that we engage in is with regards to the 4 quadrants of overdose prevention. So as you can see here on this slide, it includes mixing, tolerance, not using alone, and the inconsistency of drug quality and potency. So these are when we're providing education. These are the 4 pieces of harm reduction, the basis of it, the foundation that we're looking at in terms of providing education to individuals who are actively using substances to be able to reduce the harm and reduce the risk with regards to overdose. So what is opiate case management? So as it was shared, I'm a part of the opiate case management team here at Pinewood Center. We have different teams that provide different services. So opiate case management is a specialized service that's provided within Pinewood Center and is an intensive case management team, which means that we meet with our clients at least once a week or bi-weekly. And sometimes that could be more frequently. That could be as often as daily if that amount of support is needed. With the intensive case management service, we are also available to meet clients in the community, not just in our offices, and we offer services by phone, virtual, and in person. So it really is that low barrier, meeting a client where they're at, looking at what do they need right now in this moment, and how can we support them with regards to those goals. Anybody who's accessing our opiate case management services would start with brief intervention services, which is 1 to 6 sessions to be able to establish what do they need, how can we support them in that, how can we address those goals. And then from there, some people will conclude service and have satisfied the goal that they had come to services for. For other individuals, they might require more support. And so for those individuals, we would move them into our case management program, which provides service up to 1 year. And that would be reassessed every 6 sessions with regards to their goals and their achievements, any setbacks and any treatment changes that we might need to do, as well as a recommitment from them that they want to continue working on those goals. As a part of that transition from brief intervention services to case management, they would also complete the standardized addiction assessment, which is known as our GAIN Q3MI AUNT. So that would also be completed as a part of the case management program and help to be able to determine appropriate services and goals for the work that they would be working on in case management. As a part of this program, we look at specific targeting, we provide individual support, there's group support available as well, and we really work on being low barrier, linking people to services, and advocating in the community where advocacy is needed to be able to provide people with timely services and the supports that they need. I'm going to turn it over to Ashley to talk a little bit about the RAM services.
Thanks so much, Stacey. So as mentioned earlier, my name's Ashley, and I am one of 2 of the addiction counselors here in our Rapid Access Addiction Medicine Clinic. Essentially what RAM is, it really offers fast, low barrier access to quality care for individuals who are struggling with substance use concerns, primarily alcohol and opioid related addictions. However, we do also support individuals with various substance use. This will focus a little bit more on the alcohol and opioid use side. We are speaking of opioid concerns. So essentially what would happen is an individual would come in, we would provide an assessment of sorts, an intake, to determine treatment options and really, as Stacey was mentioning earlier, meeting that person where they're at with their goals. We offer medications for alcohol and opioid use disorder. We also offer overdose prevention, education. We do also support individuals by giving them the naloxone and fentanyl test kits as well. We make referrals to our Pinewood community treatment programs and services, as we are all part of the same umbrella. We often will, connect with our partners at our community treatment programs and just make our internal referrals that way for them. If they're needing counseling supports, groups, for example, an individual might consider coming in and staying in our residential withdrawal management facility here at our Center Street location. So we can always refer the individual to come in and stay with us for generally a period of 5 days or so to go through that process of withdrawal in a safe, supportive environment. So we can link them with that service as well. We do also offer the same support. However, if the individual maybe can't come in and stay in our residential facility, we're able to support them as an outpatient. So giving them medications and ongoing support while they are going through the process of withdrawal in their home environment. No referral is needed for our RAM clinic. So, nice to have referrals from our community partners, however, not necessary. We do often get a lot of referrals from our hospital. We get a lot of referrals from family physicians as well. Sometimes they're really unsure how do I best treat my patient? How do I manage their opioid use concerns? Maybe they've identified with their GP that this is something that they have been, thinking about for some time. So often they will connect with us and we can, provide that appropriate treatment for that person. So generally that's RAM. Really what the team consists of, just for information's sake, is 2 counselors, 2 nurse practitioners, 1 physician, and a nurse as well. So it's sort of across the board of making sure that person has the medications, which we know are imperative and life-saving, and also making sure that they've got the appropriate counseling supports and therapy. And, as they transition through whatever that looks like for that person, that they've got that ongoing support, as Stacey had mentioned, with the Opiate team and their wonderful program that they offer. So this is, and some of you may have seen this before, this is a tried and true stage of change. This is just the model that we all in our programs and services here really help us determine how do we best meet our needs of our clients. So as you can see, there is sort of a continuum here from pre-contemplation through to contemplation, preparation, action, maintenance, and termination. There is also, some models that do show relapse as well, as we know that sometimes individuals do experience that. They can move through this at various stages in various times. Oftentimes we see a lot of people around contemplation, preparation, action, and maintenance phases. Usually when someone's in pre-contemplation, there's no consideration of what's happening, right? And whether that's, they're not experiencing any negative consequences of their use just yet. They maybe don't consider it to be a problem, whatever that might be. Contemplation is definitely more where, well, as contemplation is, right? You're deeply considering something. There is a thought in one's mind that maybe some changes need to be made. People can stay in this phase for quite some time. Sometimes it can be a couple of weeks to several years before any action is or preparation is made. A lot of folks we see are starting to prepare. I'm speaking specifically in the RAM clinic. We have a lot of people coming in that have heard about, medications that might be helpful for their opioid use. Maybe they've talked to someone who has been on Suboxone or Sublocade or Methadone or one of those life-saving treatments, and they want to come in and they want to discuss, what does that look like? How does that work? Sometimes they'll start right away, same day. Sometimes they go home and they have to consider. Sometimes they have to prepare for what that looks like for them if they're going to plan on coming in and staying with us. So there's sort of various stages, and I won't continue on with stages of change, but I think the most important piece to take away from this is that we here at Pinewood Center match the appropriate treatment based on the individual stage of change. So we often talk about stages of change because that's where we learn so much about where that person is at and how do we best match the appropriate service for them.
As it relates to the work that many of you are doing as well, and where this might apply is with regards to requiring somebody to attend addictions treatment, right? When we think about the stages of change, if somebody is in the pre-contemplation stage of change, they're not really seeing the negative effects of their use. They want to continue to use, and they're required for legal reasons to quit using, or told that they need to attend so many sessions of counseling or attend residential treatment. It might not match what the client's goal is, and their level of success substantially decreases. Versus if we are able, and there may not be the opportunity in the system in which you work for that to occur, but if we are able to better understand, well, where are they at right now in their recovery and or their journey of substance use, and match it with an appropriate service, right? You're not ready to go to residential treatment, but are you willing to attend an information session with RAM to discuss how your substance use is affecting your health? Are you willing to get some blood work done to look at Maybe some of the harm that has happened. Have you contracted hepatitis C or HIV as a result of your use? Maybe this is something somebody's willing to do. And as a result of those results that they get, maybe they're willing to take that next step. But when we look at the stages of change and the work that we do in addiction, it's about taking small baby steps rather than huge leaps, and being able to understand that internal motivation is the most powerful piece in anybody making any change in any goal that we have, whether it's substance use or otherwise related.
So some barriers that people experience who are using substances, oftentimes we'll see, attendance issues. So a lot of our clients are unwell. Maybe they need medical care. They're in hospital. Maybe they are currently staying in our residential withdrawal management service unit. So in terms of this, what's happening is they're not able to attend important court dates, for example, meetings, things like that they're required to be doing within their requirements. So what's happening is we're having a lot of people coming in and they're experiencing some stress because they know that, their health and their medical care is important, but also there's expectations that they have to attend certain appointments. So some of those barriers are often difficult that people are facing. Some residential treatment programs, so longer term programs than our withdrawal management are unwilling to accept folks who have pending charges or who have specific charges. We are seeing some of that where people are just not being accepted into their programs for those reasons. Another barrier is complexity. We know that a lot of our individuals that we see are also experiencing concurrent disorders, mental health concerns. They have dual diagnosis. So, oftentimes people are kind of focusing on one thing, whereas we need to look at the whole person. We need to look at not only their substance use, not only maybe their living conditions, maybe, their current charges pending, but their mental health. Like as a whole, this individual needs support in most areas. So we really need to make sure that we're looking at that, not just kind of siloing the treatment based on, substance use. The ability to advocate for oneself is really, really huge. I think we see a lot of people who, have been in oppressive situations. They've not been able to, speak freely. They've had trauma. They've had a lot of really difficult situations throughout their life, and they've lost their voice. They've lost their ability to stand up and advocate for themselves. And sometimes they don't even know what's out there. Sometimes someone even hasn't had an opportunity to sit down with someone to learn, what are my options? They may not know what a diversion is, for example. So giving the people the opportunities to hear those things is really important. And oftentimes they don't. So that's a big barrier. Wait times. I'm sure we all know about wait times. We wish that we could get people in as soon as they walk through our doors. If they're in the right stage of change, they're ready to go, and we want to send them right where they need to be. Our system doesn't work like that. So residential treatment right now, depending on the program, can vary between 1 month wait all the way up to a year, depending on the facility. Community treatment or community treatment programs, depending on the specific service they're looking for, can be up to a 2 month wait time to be able to get connected, to have an assessment and be assigned a case manager. And oftentimes stabilization is required before treatment too. So sometimes that's difficult for individuals who have this expectation that they have to attend their program not under the influence, or maybe they have to be on certain medications. They've had to have a period of abstinence, and that's often difficult to expect of people. So that can be a barrier as well as the client's own autonomy. We know that throughout substance use, throughout their journey, whatever that looked like for the individual, they've lost parts of themselves. They've been influenced by others. As I mentioned earlier, they've lost the ability to advocate. And so it's very difficult for our clients to be able to, have that self-governance, right? To be able to say, like, this is what I need, this is who I am, these are the services that I need. So we really need to work on that with individuals and try to lower all of those barriers. There's lots more barriers. We could have probably filled pages of barriers that we've seen, finances, transportation, homelessness, just there's a ton of them that people who use drugs can experience, and it really affects their ability to enter into programs and treatment, have that regular follow through, meet everyone's expectations of them. And so we just want to make sure that we're very aware and we try to minimize those barriers as much as we possibly can for them. So discharging from jail, this was one that we spoke about quite a bit actually when we were putting this presentation together, because as we know, when individuals are incarcerated, we know that a very high risk period of time for them for a fatal overdose is after a period of non-use. So their tolerance has drastically lowered. So if an individual is incarcerated for a period of time, we know that once they are discharged from incarceration, we do know that it's a really huge opportunity for us as people in the community to look after those folks and make sure that they have all the right things in place to hopefully prevent a fatality. So distribution of naloxone on discharge is, I think, probably one of the biggest harm reduction safe overdose we can look at, making sure are the people who identify, or maybe everybody's getting them, I'm not sure if it's happening or not, but we're hopeful that it is, that they are getting those naloxone kits, making sure we're linking them with those appropriate community providers. So whether that's RAM, again, from my experience working in the RAM clinic, we have connected with many different facilities who have said we've started an individual on Suboxone, for example, while they've been incarcerated. Are you able to continue to provide that treatment for this individual once they're released? So making sure there is no gap in time where that person may come out and may not have those life-saving medications on hand. And then, maybe they start to experience withdrawal symptoms, and then that could potentially lead to a relapse, and that could potentially lead to a fatal overdose. So we want to make sure we're linking people before they leave the facility to make sure that they've got an opiate replacement therapy provider, they've linked with a RAM clinic, they've got a plan in place to continue those medications if started. Also, on that note, connecting with opiate case management team, making sure that they've got that ongoing counseling, the supports, the navigation, working through as they are now reintegrated back into their homes or community, that they have that support ongoing. And then making sure that the goals match the readiness for change. I think we've said this a number of times already, but just making sure that where that person is at, we're creating an opportunity for success. We're not assuming what that person wants. We're not making their goals for them. We're allowing them to advocate for themselves and tell us what it is that they need, so that we have set them up for as much success as possible, and making sure they're realistic, so that it's not something that, we're looking at a year from now. We're looking at 6 small steps of success so that that person continues to feel motivated and encouraged while they're reintegrating into the community. Strategies for best outcomes. So these are, again, sort of more along the lines of harm reduction techniques as well. So strengthen positive sanctions for progress, meaning this is an example of contingency management programs for individuals who identify using stimulants. So if you're not familiar with that, contingency management program is essentially a program where individuals will come a couple of times a week, sometimes depending on how that program is set up, and they would provide a urine sample. If they provide a negative urine sample, their names are entered into a draw to get certain benefits, prizes. Sometimes it's gift cards, things like that. So really what it's doing is it's encouraging the individual in a positive way, and they're also getting, positive outcomes. They're receiving prizes and things like that. So it's a bit of a strategy to use. It has been used for individuals using stimulants. However, I think there's good opportunity to implement this for our opioid programs as well. Just about embracing harm reduction strategies. We've talked about those as well. Minimizing our barriers. Harm reduction is often a progression towards abstinence. It's, again, those small steps that we're talking about. So if the individual identifies, I want to, maybe only use 2 days a week versus 5 days a week, fantastic. If they want to change how they're using, maybe they're using intravenously, and instead they want to use in a different format, fantastic. As long as we're reducing the harm, we're doing good work, and we all need to kind of keep our minds on that. I think a lot of times people identify, progress as, a huge goal, whatever that is. But for us, we really identify, important steps someone takes by those very small steps that they're taking, because they really are huge. Minimizing risks, as Stacey had mentioned earlier, just about making sure that if they're going to use, do they have safe supplies? Are we providing them with naloxone kits? Are we providing them with fentanyl test kits, the xylazine kits, all of the things? That's okay, Stacey. Making sure that they are set up for as much safe use as we possibly can. Another thing to kind of help with best outcomes would be asking people, like, what are your goals? What are some things that we need to work on between now and, our next appointment in 2 weeks from now? What are some things that we're able to realistically and in a timely fashion achieve? Something we often use is scaling. So, on a scale of 1 to 10, how likely are you to be able to reach this goal? If it's a 2, okay, maybe we need to adjust our goals. But if it's, 6, 7, 8, 9, whatever that might be, we know that individual, it's realistic for them and it matches where they're at. And so when they achieve that goal, they're given that motivation and that encouragement. And then the next goal, can be easily achieved as well. And again, understanding stages of change is really important. So as we kind of conclude, our presentation, and Stacey and I have talked greatly about, what are some things that are really important for people to take away today. We'd encourage you to take a moment. The insights we shared, they're not just theoretical, they are profoundly impactful for people who are using substances. If you can consider some of the things you've learned today and can inform your approach with people, that's wonderful. Those are the things that we want you to be able to take away. How can it shape the way you interact with people? What's the importance of empathy in the work that you do? The need for making sure we're connecting with our support systems, connecting with our community providers. It takes a village, as we know. How can you take some of these things and apply it to what you're working with your clients? How can you contribute to creating environments where people are feeling safe, they're feeling understood, they're feeling respected? We always want to make sure that we have a healing environment where recovery is, of the utmost importance for the people that we're seeing. As we, incorporate these into our work, we can make a big difference in the lives of those that we see. We approach the work with compassion, with dedication, and we always want to make sure that we're fostering positive change for all of our wonderful clients. And I just want to leave just a final note, and I'm sure you've all heard this before, but it's really something that we really encourage everybody to think about in terms of how do we work together? How do we make sure that everybody has the best possible outcome? And it's that alone we can do so little, but together we can do so much. And I think that has huge impact, not only in the work that we do together, but also for our clients and our individuals that we're seeing, knowing that, it's not just one person that's supporting them. It's a whole community of people who care, who want to see them, succeed, and who want to make sure that they have the best possible outcomes. Thank you so much. And, how to connect with the team. So oftentimes we get a lot of referrals through our Central Connect program. So we've started our new sort of streamlined referral process through Central Connect. So you can call, you can fax your referrals, you can email to the above email here, and also patients can self-refer on the Oceans form online as well, so they can absolutely self-refer. They can call the RAM clinic. We have a walk-in as well, so our RAM clinic is sometimes by appointment, but mostly walk-in. If for some reason between 9 a.m. and 11 a.m. doesn't work for the individual, which we understand sometimes it doesn't, they can give us a call. As I mentioned before, no referral is needed. They can just give us a call, we'll book an appointment, or they can literally show up any day of the week, Monday to Friday, and they'll be seen in our RAM clinic. Our opiate case management programs are available at all 5 of our community treatment office locations. So each location has a specific opioid case manager at that location. Stacy is one of them here at our location, and her contact information is listed there. Stacy mentioned earlier, there's no wrong door. There is nowhere that someone could call any of these places and not make sure that if they maybe weren't in the right place, we would definitely direct them to the right place. That's what's so great about all of our services is we're all linked together. So if someone calls me, maybe not appropriate for me, but they are for Stacy, I'm going to make sure that that person gets linked with them, and it'll be likewise for any program that they connect with. So that's how the best way to connect. We have 24-hour telephone support as well. So for individuals who are just looking for information, they can call the main number there listed, and then just ask to speak with a counselor, and they're able to get all of the information, all of the services, and then they can consider what would be best appropriate for them. And we'll leave it to the questions.
Yes, just a reminder, please send your questions to the Q&A. We don't have any questions as yet, but feel free to send your questions to the Q&A. I've got a question. When you were speaking, you talked about the fact that you apply harm reduction, and then you indicated that there are a lot of people who do harm reduction towards abstinence. What does that mean? What exactly do you mean by that?
So that really means harm reduction and abstinence. Harm reduction is kind of the journey of getting to abstinence. Abstinence meaning that a person doesn't use whatever substance was problematic for them at all. Harm reduction is anything that happens before that. So that could be reducing their use, being educated around the harms of their use, wanting to start medication to reduce some of the side effects of the use, getting some medical intervention. So harm reduction really, when we look at it on that continuum, we look at it on like one end is somebody actively using substances, on the other end is somebody who doesn't use substances. And harm reduction is everything that happens in between. All the support that it takes, all of the medical intervention, all of the education, the harm reduction supplies and services that are offered in the community. It's every step that we take to keep somebody engaged in service, safe from harm as much as possible, and reducing the risks of infection. You're on the your button's on mute still.
Okay. All right. Yeah. Another one. Thank you. In your presentation, you talked about stages of change and importance of meeting people where they are. Within the court system, we've developed things like drug treatment court, mental health courts, community courts, and so on and so forth. And many times people, even though it's supposed to be voluntary, I mean, in practical terms, people enter for so many reasons. They want to get out of jail, they want to, whatever it may be, right? So many times they may not necessarily be at a particular stage of change that could actually engage in changing in terms of being successful. At least that's what it seems to us. So my question to you is, if somebody goes through a program like that and they are not truly ready, is there any place in which you as treatment providers can help them get to a stage whereby they internalize the desire to change?
Yeah, I think that's a great question. Because we do have services that are from one end to the other of the stages of change, there would always be a service for them here. So we do have clients that are mandated to attend service that don't want to make any changes to their substance use, And in that, we provide them with education information about substance use, the risk of harm, the possibility of infection, resources. And through that education process, we're hoping to increase their motivation to change. So it's designed and based on our motivational interviewing therapy model. And the program that they would do either individually or through group would allow them to be able to do some self-assessments. Like, we provide information and education, and then they complete some self-assessments around, like, how does this information impact me? Is this changing my thought process? Is my substances actually having an impact on me? You know, we look at things like family dynamics, employment, finances, physical health, legal issues. So we look at all different kind of life areas, and how does the substance use contribute to or take away from those different life areas? And so doing that kind of brief intervention often will help somebody to be able to identify pieces that they weren't considering prior to coming in. And that can help to be able to shift them to a place of readiness for change. The other piece with that I would mention is that when we think about matching somebody with the appropriate service, sometimes it's just the small steps. And I'm thinking of an individual who's been through the legal system. A kind of a case example is a gentleman who had been through the legal system, and he was continually getting in trouble, for lack of better words, for missing his court dates, right? He was missing court multiple times. And it was getting to the point that he was going to be incarcerated because he had missed so many court dates. The issue wasn't that he was choosing to miss the court dates, it's that he had a brain injury which limited his capacity to be able to remember those court dates. And that wasn't known to him or to others. He remembered his experiences that he had in life, but he didn't know how much his brain had been impacted by this. And it was only through further assessment and education and getting to know the individual that we started to notice these patterns and was able to get him some appropriate treatment with our other hospital programs, which allowed us to better understand how the individual is functioning so they could have success in the core program, their addictions counseling, and all the other services. So it really opened up the doors. So sometimes it's about just being able to notice what's happening with an individual and what can we do different. If this isn't working, where else can we go? What other supports can we engage?
Okay, and then my very last question is this. You've worked with people from the legal, from the justice end of things many times in dealing with these type of issues. If you were to give advice to those of us who work in the justice system, what do you have 1 or 2 or 3 points, things that you think we should be aware of when we're dealing with this population? I'm setting you up, you know that.
Well, first, I will acknowledge that the diversion programs that do exist, and I'm specifically speaking about Durham because that's where my experience lies, but I'm sure that they're all very similarly provided. I can speak to the success of them. I've had many clients who have engaged in them and been able to get to a place of abstaining and reaching their goals, and having that accountability and that assurance and somebody who's cheering for them in their corner is a much different experience than some of the other legal experiences that they've had. So I can speak to that. I think if there's one thing that you can take away, or the one thing that I always encourage people to do, is to celebrate the smallest successes. Somebody showing up to court could be a huge victory for them, right? And we never know somebody's background or where they've been before they presented to us in that moment, right? And a lot of times people have gone days without eating, they're unhoused, their mental health is severe, their family dynamics are challenging, they may have their children in custody. And so we never know what somebody is showing up there with. And the fact that they just showed up to court could be all that they can do that day, right? That might be a small step. There might be 100 steps to getting them to that place of abstaining, that place of not using, that place of not committing criminal activities anymore. But showing up today is step one. right? So make sure to celebrate all those small successes. Make sure to acknowledge those, because that goes a long way with an individual who might have battled a million things just to show up in your courtroom. That would be mine. Ashley, I don't know if you have something you want to add.
I absolutely agree and second what Stacey said. You know, without repeating, I really think that keeping that fire going in that individual is really important, because we know it's very easy for that to be dimmed out, and throughout their lives that's what's happened. So the fact that, you know, there is still a little bit of a flame and they're still, you know, willing to show up, it's really, really huge. And you know, just always treating everyone, you know, with empathy and compassion and respect goes a long way for them to want to come back and see you the next time, and want to be involved in services, and just being respected and understood is really, really huge, no matter where they came from. So that's often, you know, a really important part for us, and always keeps people, you know, involved in our services, regardless if they're supposed to be here or not. Thank you so much.
I was just going to add one last thought, and the last thought for me was just around when we conclude with clients at Pinewood Center, when we end or when we graduate people out of services, we often talk about what it started like and where we get to in the end. And I know from the experience of working here for quite some time, what clients often talk about in any service, whether it's addictions counseling, court system, physician, working with their physician, et cetera, with regards to addiction work, is if you can validate them, right? If they can feel heard, they can feel valued, and you can leave them with a glimmer of hope, those three things can really help bring somebody back, right? That can really help to engage somebody to feel like you want them to be well, that you are on their team, you are working with them instead of against them. So those are some words of encouragement that I would leave.
All right. Stacey and Ashley, thank you very much. We don't have any questions at this time, but thank you very much for taking time out of your busy schedules to generously give of your time. What you've taught us today will be recorded, and everybody who has registered will get a copy of it, and it will also be on the AJTP digital library, so people can go back and check it out. And I know I've learned a lot from you today, and thank you. So with that, we shall wrap up, and the next session will be at 1 o'clock today. But Stacey and Ashley, once again, thank you so much. All right. Okay, with that, we will, as they say in court, we will adjourn. With thanks. Thanks.